Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I am going to tell you what if you want hair transplantation and you have a limited donor area from the back of the head. Means you have undergone surgery in the past in hair transplantation and you cannot get much hair, the donor area is very weak. What can be done about it? So do not worry now. Because with FUE technology, what's new coming is body hair transplantation is becoming more and more popular. So if your donor area is limited on the back of the head and you have good hair on the beard area and chest area, we can use these as donor areas. So in body hair transplantation, we have various options. We can use the beard, we can use chest, we can use legs. These are the various areas from where the hair can be taken. But best amongst all the body hair is the beard only. Because the beard hair are very close and resemble the scalp hair very much. Now, I will just tell you that hair have got different phases like anagen phase, telogen phase, catagen phase of the growth and development. Anagen phase is when the hair are active and growing. And catagen phase is when the hair are resting, they are not growing, they are like sleeping hair. Now in the scalp hair, about 75% hair are in the anagen phase and 25% are catagen or the sleeping phase. In beard, 70% of the hair are active and anagen and 30% are in the catagen or the sleeping phase. Now come to the chest. The chest anagen phase is only 40% and 60% is catagen. That is 60% are in the sleeping phase. This is something we have to keep in mind when we are doing the body hair transplantation. Which means if we take the hair from the chest or from the legs or some other part and we take 1000 hair from that area, only 300 to 400 hair would be seen at a time, not more than that. So that is why the response rate with the body hair transplantation is little less than the scalp hair. Now in the beard, this problem is not there because about 70% of the beard transplanted hair would be seen very easily, would be in the anagen phase, would be active, would be growing. So this is one thing we have to keep in mind. The other thing what we have seen is that the take-up of the beard hair is very fast. The beard hair grow much faster, and in a study they found compared to the hair taken from the scalp and from the beard area, the hair take up much faster, grow much faster as compared to the hair from the scalp. So beard hair are ideal hair for transplantation. One advantage with the body hair as compared to scalp hair is that in body hair we do not require DHT blockers. So we don't have to give minoxidil or we don't have to give minoxidil, the finasteride or dutasteride or any other DHT blocker to the body hair because they do not require DHT blockers. They can survive in DHT blocker. They don't require DHT blockers to grow. So that is another thing. We should avoid in fact DHT blockers when we are using body hair and transplanting the body hair. So this is another thing, another difference between the body hair and the scalp hair. Except for the beard hair, the chest hair and the leg hair and from other part of the body grow much slower as compared to scalp hair. So the result takes much longer time, almost 1.5 to 2 years for these hair to show their result as compared to the scalp hair. So these are the differences when we look at the scalp hair and the body hair. In a nutshell, I'll say that the body hair grows slower and they have smaller anagen phase, longer catagen phase, and the growth is much slower. They take much longer time for the result to come. But they do not require DHT blocker for their survival. So DHT blocker should not be given along with the body hair transplantation. These are few differences between body hair and the scalp hair. If we are doing body hair and scalp hair together, it is ideal to mix body and the scalp hair together to give good results in the scalp, to give very natural looking result. Instead of giving body hair in one portion and the scalp hair in another portion of the scalp, if we mix them together, the results are more uniform and better. So with this, I thank you friends. I am Dr. Sandeep Bhasin from Carewell Medical Center.